Yeah, hi Jen. I can hear you. Welcome. So
Welcome. Hello.
we'll right away jump into the session with Jen. It's going to be a very, very interesting session. And just before we even introduce Dr. Jen Unwin, very happy and excited to host her. And for those who don't know, Dr. Jen has already been on the D Life podcast, and some years ago. And we also have a podcast with Dr. David Unwin at D Life. In fact, he was one of the stalwarts who reviewed the D Life forum, when Anup had started off. And D-Life also partnered with Dr. David Unwin to translate his iconic sugar infographics into 9 Indian languages. And I'm very, very proud of the fact, Jen, that he wore the Indian kurta that I had sent for him. And he even posted a picture of himself on Twitter after wearing that. And yeah, yeah. And recently, just as a conversation recently, a UK-based doctor contacted me, and she was mentioning Dr. David Unwin and how he had recommended the D Life diploma course for her, and he routinely keeps recommending the D Life recipes as well. We had him in the first Metabolic Health Conference, and
Yeah.
I had the pleasure of interviewing him. So welcome. So
Thank you so much.
yeah. So I'll jump into the introduction part before we begin the questions. I am Ira Sahai, the Chief Operating Officer of D-Life Healthcare Private Limited, a D-Life certified metabolic health coach and your lead host for the Metabolic Health Conference 3. D-Life is India's first and the only award-winning low-carb platform founded by Anup Singh in 2014, a silver medalist from India's Ivy League institution, IIT Roorkee. He's the recipient of the Icons of India Award by the Outlook Group in 2022. And D-Life has had the pleasure of being reviewed by, as I call him, the doyen of low-carb, Dr. David Unwin. Um, before and just to continue on that, Anup is the pioneer of the low carb movement in India with a path-breaking protocol of 100-gram carbs per day max given by him in 2012 that made not only LCHF but even type 2 diabetes remission possible for Indian vegetarians, which is a very complex grain-based vegetarian plate. So a bit of introduction on our guest today. Dr. Jen Unwin is a clinical psychologist specializing in food addiction and low carb nutrition. She helps people overcome sugar addiction and improve health through behavioral changes. Her famous book, Fork in the Road, explores food addiction psychology, and she collaborates with her husband, Dr. David Unwin, to promote low carb approaches for metabolic health. What a pleasure to have you here, Jen. And D Life has always had so much love for you and Dr. David Unwin. We cannot thank you enough.
Oh, it's such a pleasure to be here, and we've loved watching what you've done and how the organization have grown and the difference you're making. That's, everything we ever wanted when we started was just that other people would do the same and make a difference for people. So it's been a pleasure to watch what you do, and we always recommending the website and the recipes to people. So
Yeah,
thank
yeah.
you.
Thank you so much for that, Jen. And we really value your association with us and also Dr. David Unwins. So let's start with your such significant work that you've done in the field of addiction. Jen, please start by telling us how did you start working in food addiction? And just as an extension of this question so that we can cover more, how do you define food addiction and what are the key signs that somebody might be struggling with food addiction?
Yeah. Okay. So you've talked about the work that we've done with David. So we started maybe 13 or 14 years ago now in his general practice in the UK. I'd read a book, and some of the listeners may have come across it. It was called Escape the Diet Trap, by Dr. John Briffa, who was a British GP also at the time, who was way ahead of his time and was talking about low carbohydrate diets. And it was just one miserable January day. I've struggled with my weight gain, and then doing a scheme and losing weight and then putting weight on again all my life. And I just saw this book, Escape the Diet Trap, and I thought, well, that's what I need. It was just the right book at the right moment. And I read this book, and it really, as I say, it was about low carb, and it explained the science. And I'm a scientist, so I loved that. I could completely see what he was saying about carbohydrates and insulin and how that drove hunger. And he gave the diet plan, and off I went. I'm the kind of person, if I think, oh, that's a good idea, I'm going to jump straight in with both feet. So I jumped straight in with both feet. I felt terrible, awful for about a week, but he'd told me that I would. And that's because obviously I was, moving over to burning fat for fuel. So I stuck with it. And then on about day 8, I just felt incredible. It was a real step change mentally and physically and everything. And the weight dropped off. And I kept boring David with passages out of this book about insulin and carbohydrates. And then he saw the difference it made to me. And he was a bit fed up, really. He was kind of looking back, we discovered eventually that he was actually a type 2 diabetic. He'd gone a bit sleepy. He was a bit sort of stressy. He was kind of fed up with work. And he did it as well. And he felt so much better. And he'd always worried about the patients in the practice. Since he'd started, there's been this tenfold increase in people with diabetes. People getting sicker and sicker on more and more medications. I mean, we've all seen it happen. People our age have seen it happen in our lifetimes. The population going from sort of healthy to increasingly unhealthy and chronic conditions. So he's a bit depressed about that as a career in medicine. So we both said, well, why don't we do something in your practice? We'd never worked together before. And so off we went, and we did our first low carb group. We were a bit timid, so we did people with pre-diabetes, 18 people, but they all did remarkably. They came off medications, they reversed their pre-diabetes, and you know the story. It's expanded ever since. And now David's got well over 150 cases of drug-free type 2 diabetes remission that's maintained. He's just looking at the data now for another paper. And fortunately, other people have taken it up like yourselves and are sort of spreading the good word. However, we did find, and I did find, so it's kind of my personal story as ever intertwined with the science, is that yes, low carb is amazing and it works for all kinds of health conditions, but some people struggle to keep to it, even though they feel so much better, they're coming off medications, they're losing weight, it seems like a no-brainer. Some people, even with all those benefits, will struggle to keep low carb. And I was one of those. So even though I knew all the benefits, birthdays would come and I'd think, well, I'll just have a bit of cake because it's my birthday. And then I might struggle. If I did that, I might struggle. And it sounds ridiculous, but if you're a food addict, you'll understand. I would then struggle for a few months to try and get back to the diet where I felt really well on it, a sort of low carb ketogenic diet. And we found that in the practice as well, that there was a proportion of people, despite it being even more life-saving than it was for me, their blood sugars would be terrible when they weren't sticking to a low carbohydrate diet. They would that would happen, and then they'd sort of go into this denial state and avoid us. And so what we tried to do in the practice was understand that, and I tried to understand it for myself personally. And again, my eureka moment really was listening to Bitten Johnson on the Diet Doctor website, and you've had her on Summit. So if people haven't heard that, they need to go back and listen to her. What an inspiration that woman is. I watched this video of her talking about sugar addiction, and suddenly all the pennies dropped. That my behavior and the patient's behavior was exactly like people's behavior around cigarettes, alcohol. It's an addiction, and that made total sense to me. It's kind of not our fault. I think what people struggle with is that they feel they should be able to deal with this thing with willpower, that because they can't. And I was in that camp, and I was a psychologist, for heaven's sakes. So, I should have been able to manage my own eating behavior. I'm an expert in behavior. Why couldn't I manage my behavior was like a shameful thing for me. But once I understood it was an addiction, I could see, well, it's not my fault, in a sense, that the problem is with the substance, and in this case certain kinds of foods, not all foods, certain kinds of foods, And if I can be abstinent from those foods, I don't have a problem with the addictive like behavior that I'll describe in a moment. So that was like the epiphany, and was sort of, why hadn't I thought of that? I've dealt with people, I've trained as a clinical psychologist. I know about food, about addiction. We all know about it. We've all have members of the family who struggle with certain kinds of addictions. Why hadn't it occurred to me before? And I think it's, that a lot of us with food addiction will do anything to keep our drug foods, our carbs. We're kind of in denial. We don't want to admit that we've got a problem, really. But once we do, that's the liberating piece of information for many people. So I think it adds another piece to the low carb puzzle for a proportion of people. And there was a lovely paper, was it 2022, I think, end of 2022, showing that if you've got a food addiction problem, you're actually 7 times more likely to have type 2 diabetes, which makes total sense, because the kind of foods we overeat are sugary, carbohydratey foods. Those are the ones that have that addictive potential. So we're overwhelming our system with those foods, and that eventually the body struggles to keep itself in balance. So that it makes total sense that there's that. Not everybody with food addiction has diabetes, obviously, but there's that link, and there's that link with obesity and other conditions. But again, it not 100% of people. Some people are normal weight or underweight. So the second part of your question. So that was how I started thinking about it. And then, I trained with Bitten. I did her training. And then since then, I've collaborated with a nutrition consultant who also trained with Bitten in the UK, Heidi Yever, who's an incredible powerhouse of ideas and projects. And we've been working together ever since, both on research, but also on the campaigning side, which I think we'll come back to later. So how do you recognize it? Right. So for those in the States, that they use a diagnostic manual for mental disorders called the DSM. And for those of us in Europe, I'm not sure what you guys in India go by in the medical community, but we go by a thing called the ICD, which is the International Classification of Diseases, hosted by the World Health Organization. So the World Health Organization has 6 key symptoms for identifying a substance use disorder, or an addiction, as we might call it. And obviously, up to now, the substance that have been recognized as addictive are things like alcohol, different kinds of drugs, nicotine, and so on. But up to now, not sugar or ultra processed food. But if we take those 6 criteria, I'm going to go through each one, and I think as I do so, people could either think, how does that apply to me, and count how many out of 6 you get, or they could maybe think about someone they know that seems to struggle with maintaining a steady sort of relationship with food. And we'll see whether we think that these apply to food. So these are the criteria for substances of abuse like alcohol. Let's see if we think they apply to food. So the first one is, so CRAVED is the acronym, so CRAVED, so we can remember the 6 letters. Heidi and I have come up with this, and we've developed a screening tool based on this idea of using the ICD and these 6 symptoms. So CRAVED, so C obviously stands for cravings and compulsions, which a lot of us recognize for particular foods. But do you ever have cravings and compulsions for certain foods that are so compelling, all the C's, that you kind of can't resist? You're sort of pushed to eat those foods, even though you've said to yourself, like I used to say to myself, right, Monday, the diet's starting, no cookies today. And I'd get home from work and I'd be tired and hungry, and there would be cookies on the side because, kids and I would I would reach for one, despite in my head saying I'm not supposed to be doing this today. It was almost like an automatic. So do people recognize that cravings and compulsions that drive you to eat foods even when you you shouldn't, in a sense? So see, that R stands for reaching for more, and this picks up the idea of that we all know do with alcohol of the idea of tolerance. And tolerance really describes that effect where, say, you have one glass of wine every evening with your dinner, and the first few times you do it, you might feel a little bit tipsy. You'd feel the effects. But after a few nights, your body and your brain adjust, and you maybe don't notice the sort of the effects of the alcohol, maybe that you're looking for to be relaxed or whatever. And so we add in another glass to get that effect. So have you noticed that with certain foods that you need more and more to get the same effect? So maybe one biscuit, one slice of cake, even as a child, maybe you just needed more and more, or wanted more and more to get the same effect. So instead of one slice of cake, you're eating half a cake to sort of get the feeling that you want. So that's the idea of tolerance. A stands for activities neglected, which is a very typical sort of symptom of addiction, where the whole focus of life becomes around whatever it is, in this case, certain foods. And so that you start neglecting or thinking less about family activities, hobbies, doing well at work, keeping fit, all of those sort of other things in life start to suffer because there's a lot of thinking and planning going on, either about eating the food, not eating the food, where have you got the food stashed away. Sometimes food addicts have a secret stash of food, or they really want their food, but they're trying to think how to get away and get it without the family giving them a hard time about it. So A is activities neglected. V is for volume, and this is the idea of, again, losing control of the amount, losing control of the volume of what you're eating. So saying to yourself, right, I've got this packet of biscuits for the grandchildren, I'll just have one before they come. And then once you've had that, it's one is too many and 1,000 is never enough. So this feeling that once you've had one, the brakes are off we go. Too much volume, not one slice of pizza, but 4 slices, despite your best intentions. E stands for exclusion, and this is picking up on the idea of withdrawal. So if we try and exclude those foods from our diet, do we experience withdrawal symptoms? So we all know that can happen to people with addictions to drugs, alcohol, and nicotine. If you try and quit your drug foods, whatever it is, chocolate, do you actually get some physical and mental negatives, like maybe poor sleep, like stomachache, shakiness, anxiety, depression? People often report that they really struggle with withdrawal symptoms when they try and quit sugar. And that's what I was going through. Obviously, when I did my first week of low carb, I was actually, withdrawing from all these amazing foods. E and D, finally. So finally, and this is really the defining one for me for addiction, is continued use despite damage, D for damage. So do you know, for example, that eating these foods is making your type 2 diabetes worse? Is it leading you to putting on more and more weight, which is making you feel unhealthy and unhappy with yourself? Do you know that you actually feel more depressed eventually when you eat more and more of those foods, or anxious when you eat certain things? And do you carry on with that behavior anyway? So despite knowing it's harming you, or the family thinking it's harming you, which is often the case, you can't stop, or you can't control the amount. So those are the 6. So I'd invite people to kind of think, how many have I got out of 6? I definitely had 6, and have at many times in my life when I've lost control of my eating. And most of the patients that I work with have got 5 or 6 out of 6 of those symptoms, because they tend to go together. So that's how you would recognize it, and it's how practitioners might recognize it in their clinics, or they can use we've got an actual screening questionnaire based on those questions that people can sort of quickly fill in. So it's a quick 6 question, does it look like I've got that problem? And I think we'd all agree that yes, those symptoms can apply to food, even if you've not experienced that yourself. I'm sure you can recognize either in your patients or maybe in some member of the family.
I was just going to come to this, Jen, and every day I see this, India being a carb heavy nation, and this
Yeah.
is so obvious. And I find the symptoms that you were describing and the tool craved. I was trying to match it up with the experience that I have with my clients, and at least 3 to 4 of them exist anyway. And I've had people telling me, everything's going on well, the blood markers have improved, but I'm feeling very weak. So what do you do in spite of all that counseling and talking to them? And you would not believe, before even we planned this MHC, this one of my mentees, and I told him, you may be having a food addiction. And he outrightly denied. Of course, denial comes first, as you said. And now when you're talking about craved, I can match his traits one by one. And this is exactly, he feels better when he takes honey, or he feels better, when he takes some kind of sugar, basically fruits in the morning. So
Yeah.
this is such a brilliant tool, and I'll remember this. And I was trying to listen and absorb as much as possible. Brilliant,
Yeah.
Jen. Yeah.
Well, and I'll give you the website where, I mean, we're sort of developing it, but people will be able to sort of have a look and download it there, or maybe work with us if you want to share data or whatever. They can work
Definitely.
with us on that. Yeah, I think that's the difficulty. It's that interim period where you're trying to get people out of the sugar. Yes, they're going to feel worse, because that's how addiction gets you in a way, isn't it? Eventually all you're doing is taking the substance to get rid of the withdrawal symptoms. So people who've got a real addiction to alcohol or nicotine, they're not drinking or smoking to feel amazing. They're drinking or smoking to get rid of the withdrawal symptoms. And that's how we'll probably get onto it, but that's how the brain works with addiction. And you have to break through that phase with support and come out the other end like I did, and then see, oh, okay, this is how good you can feel when you're not a slave to, like you say, you have to get up in the morning and have some sugar because you feel so weak and awful. Once we're fat burning, we get up in the morning and we feel amazing. We don't have to eat till lunchtime. So but that requires a lot of support, a lot of education, obviously.
Jen,
And
would you agree that, is it any different from alcohol and other substance abuse kind of addiction, or is it just the same? Is it as bad as those?
yeah, I would say it's exactly the same in the brain. So, if people are taking scans of the brain, you can't tell the difference between a severe food addict and someone else with some other kind of addiction. The reward centers of the brain are involved. And, addiction, as what Bitten would say, addiction is addiction is addiction. And unfortunately, those of us who have that tendency to addiction can be drawn into other it can sort of cross over into other addictions. So oftentimes when or there's a genetic factor as well. So oftentimes when we interview people, they might have a father who had an alcohol problem, for example, or in my case, my mother was 100% a sugar addict. Looking back, obviously I saw that behavior, but I think also that there's a genetic component, because
Correct.
I was like that from very, very young. So I would say it's the same. And in many ways, what we say to patients is actually it's more difficult. And a lot of people I've spoken to, like Bitten as well, who've given up other things where they had a bit of a problem, say that actually sugar is really, really hard. I think there's a number of reasons. One, we've had it since we were children. And like you say, culturally, in certain cultures, I mean, everywhere in the world now, but in certain cultures, it's been really important, and it's kind of linked with love and kind of treats and special days in the family. So there's that whole baggage that we come with. It's the only psychoactive substance that we give children. We all know we don't give children alcohol or nicotine or caffeine even. We don't tend to make kids cups of coffee in the morning to get them out of bed. But we'll give them a sugary cereal, or we'll give them a cake, or a lollipop to make them feel better. So sugar's the only psychoactive substance that we give children. But not only that, the whole world has gone mad for sugar and carbohydrate and ultra processed foods. So we can't go anywhere without having it right in front of our noses. If we go to a cafe, there's cakes on the counter. Here in the UK, if you go and buy fuel, you can't pay for that fuel without there being a great big array of chocolate bars and crisps. It's every celebration, Christmas, we've just had Valentine's. It's just a festival of chocolate in the UK. Easter's coming up. The Easter eggs are already in the supermarket here in the UK. I mean,
I think it's just the same for India, Chen. It's the same for India. All our festivals, right from birth to death, are celebrated with sugar. And I think, in a way, we have mainstreamed and normalized this addiction, as you call it, because, there is so much of dogma and stigma attached. If you tell somebody not to eat a particular sweet dish, so much in quantity and so frequently, you get, outcasted because it's
yes,
considered normal. Yeah, it's considered
yes,
normal, and what you're telling them is actually stopping them from being happy. So we've normalized this addiction on
yes,
such a large scale. And
yes,
India being a vegetarian country, the carbohydrates addiction, the sugary treats that you say, so morning to evening we are doing this, festivals to festivals we are doing this, birth to death we are doing this. We are no better, but it makes it all the more complex because here you have huge amount of carbohydrates as well. And when
yes,
you tell somebody that I am scared of telling people actually that you may be an addict, you may be abusing food. I told that to one of my mentees, and he denied. Of course, that would come. I know. So very very great insights, and I can totally relate that. Uh,
yes,
Relate to
yes,
all of us. So
definitely.
Jen, just in short, just elaborate on what kind of modern food environment exists in today's world that has led us to this place where we are in acute denial of this.
Yeah. Exactly. Yes. So we did a consensus exercise last year with all the experts on food addiction we could find, clinicians, researchers, academics, to see what we could all agree. And actually, they all agreed that we should call it ultra processed food addiction, because really, this isn't a problem of real whole foods as nature intended. It's a problem of the modern food environment, and foods that are, we know now because that's been written about in several books and it's been exposed, foods that are engineered for addiction. That's the point. They want you to buy more and more, so they make them absolutely delicious. They've done that by, experimenting in the lab, by putting people in brain scanners so they can see which foods light up, literally which foods light up the brain, make them as addictive as possible. Like, that's kind of accepted now that that's gone on in the food industry. And I think, yes, maybe that started in America, because when the writing was on the wall for nicotine and cigarettes, those big cigarette companies, Philip Morris and other companies, bought up the food companies and then applied their sort of, let's say, addiction model to food, and the marketing models as well to food, to make them, super enticing, super delicious in a sense. I don't really find them so delicious now that I know all of this, but super delicious, and also very, it's all colorful. The marketing's amazing. We're marketing stuff to kids, cereals marketed to kids. We start them young. So I think that's all a factor. Also, I think it's just the ubiquity and the constant access. So even when I was a child, we weren't exposed all the time to advertising, to the availability of sugary sweets. I think we were allowed one one treat a week or something, which of course I, looks forward to intensely for the whole week. And I don't know if it's the same in India, that we couldn't, there wasn't that, it's okay to have these foods every day. Yes, they were for celebrations, and we did have some things at Christmas, but it's like these days, as you say, it's every day, every celebration. It's become more and more sugary and more ultra processed foodie. People are cooking less for themselves. People are buying less locally raised, healthy foods. The food supply, in certain parts of the UK, so people have been really struggling to buy fresh, locally grown foods or vegetables, or so I think there's a whole load of factors that have sort of come together, that as we see now more and more people with this problem. So the latest estimates are, for this sort of the level of food addiction problem that we're talking about, where it would be a clinical problem, probably 14% of the adult population, and as many children. Actually, it looks like the poor kids who've been raised in this environment, it's maybe even more. So 14% of all the adults in the UK is something like, I think it's something like 6 million adults probably have this problem, and they're the ones with the chronic health conditions, diabetes, so on. So it's an absolute epidemic, disaster happening, and not everyone with diabetes. We're not saying everyone with diabetes has this problem, but the ones that really struggle to stay the course, it seems to be really a big part of the story. And then, of course, like any other addiction, what you need is a lot of help and support and patience and explanation. It's not enough just to say, like, it's not enough to know that you shouldn't smoke, is it? To be able to quit smoking, you need support, or some people need support to do that. Same with alcohol and drugs. So I'm proposing same with food addiction. We need to get with the message that these people are, they're really struggling. They need a lot of help and support. They need to be with other people who are trying to do the same thing, so that, like you say, in your culture, they wouldn't feel so like they're the only one. They need a support group or a peer group.
Does this often require any kind of medication also, Jen?
I mean, so for the occasional person, David has used medications like the GLP-1s at the beginning. So obviously we know those medications have pros and cons, and some of the long-term cons aren't great. But if they're used as part of a package where people are then getting the support, they're then getting the education about how they should be eating. In fact, there's a paper just literally come out yesterday that David co-authored with Tro Kalayjian, where that's exactly what they did. Some people were on GLP-1s, but they were able to come off them once they had the right information, and they didn't put the weight back on, because then they were doing the right thing. So for some people that just can't get going, or the addiction's so, the cravings are so terrible, he does use that as a sort of interim, if you like, a bit like methadone for heroin. It's a way to sort of to move out of the problem and into the solution. There aren't really good treatment trials of food addiction, because this is where we get into the campaigning thing, because it's not a officially recognized addiction. Of course, there's very little research, because research isn't funded, and of course there's very few treatment programs, because the research isn't funded, and the treatment isn't funded or isn't reimbursed by insurance companies in the States, etc. So a big part of our mission, myself and Heidi and other people that we work with in the team, is to get food addiction recognized officially by the WHO and by the American Psychiatric Association in America, so that those treatments can be funded, and it becomes a legitimate condition for which doctors will recognize, and you'll be able to seek help and get funded help. In the UK here now, you can't. There's no help on the NHS for people with food addiction, other than perhaps David's practice, because he understands it so well now. But otherwise, people would have to pay for sort of, there's folks doing online programs, but you have to pay a little bit for that. So yeah.
Yeah, Jen, we have about 10 minutes left, and I would want to ask two very important questions. One, is there a direct link between this addiction and anxiety and depression? That is number one. And two, is there any specific role that the carnivore diet as such plays in, such situations? Does it help more?
Okay, so anxiety and depression, yes. So there's been a number of papers looking at the links between ultra processed type foods that we're talking about, high sugar, refined carbohydrate foods, and anxiety and depression. And there seems to be a dose response. So a bit like, the more of these foods you eat, the more likely you are to be type 2 diabetic. It's the same. Yeah. The more of these foods we eat, the more likely we are to have mental health challenges and problems. And that's partly because of the way that sugar works in the brain. I don't know if Bitten or one of your other speakers has sort of explained this, where you get a big dopamine hit from eating sugar. And that's kind of why we like it, because, it sort of boosts us up, doesn't it, temporarily, because what goes up must come down. Obviously, the brain doesn't really want those high levels of dopamine. It's trying to keep, like everything, trying to keep in balance. So it knocks out a few dopamine receptors in your brain, so that the signal, even if dopamine's available, the signal is weaker. That's why we need more and more to get the same effect. But it's also why then, when we're not using, when your chap wakes up in the morning, he feels really grim, because his sort of set point for dopamine is lowering over the time. So the more sugar you eat, the less available the dopamine is to you over time. And because dopamine is the neurotransmitter of motivation, the more likely you are to be feeling unmotivated and depressed, in a sense, low mood. So yeah, and the same with serotonin, which is the sort of relax hormone, a similar process whereby over time, actually your resting state is going to be more anxious and more depressed. And that's why it's the trap of, then you wake up in the morning, you feel awful, you have some honey, you feel a bit better, you get on with your day. Yeah, so there's that, there's a good explanation why people with mental health problems should be eating a real natural whole food diet without these sugary refined carbohydrates in them, which leads us really neatly on to carnivore. Yeah, so lots of people on carnivore report, very quickly, that their cravings for the ultra processed foods dissipate, and that's because these processes are normalizing. You're healing your brain with all the good minerals and nutrients, probably, that Marty was talking about, that you need to heal the brain and for the brain to work. It's an incredibly complex organ, and mitochondria need to be working well, because your brain's very energy hungry. And if your brain's working well, you get on with life, and you stop thinking about trying to feel better by this temporary boost of a cake or some fruit or something like that. So carnivore is one way, but then there's many ways, and for some people, if they go too restrictive, they have that sort of bounce back. They can't. It's more like a sort of eating disorder way of thinking about it. If they go super restrictive, the minute they slip up, which they may do eventually, then they will tend to think, oh, hang it, that doesn't work either, and I'm kind of going to go back. And like we said, that first bite can sort of lead on to problems. So it's a very individual thing how much people should restrict. what's right for them and what they can stick to. So I think the right diet is the one that you can stick to long term and you feel good and you can cope with in sort of, like you say, modern society. So it's, and obviously for a lot of your patients, they're going to want to stick to a real food vegetarian approach. And there's plenty of, it's harder, but you can recover from food addiction with a slightly more liberal whole food approach. I personally feel very well on high fat carnivore, and I personally try and do that most of the time. But I think I'm pretty far down the the food addiction continuum, and it may be that for people that have had that severe problem all their lives, that is a good solution if you can stick to it. If people are less far on the continuum, they may be able to get away with a whole natural foods approach.
Yeah, Jen, and the last final question, what do you think has the role been of dietary guidelines? I asked the same question to Dr. David Unwin as well. In getting society to such a sinister stage, everywhere, sugary foods, addiction, carbohydrates, and, ultra-processed food is pushed. And, something that is supposed to work the other way around has brought us here, actually. What do you think about that?
Yes, I agree with it totally. And I don't know if you've ever had Zoe Harcum on the podcast. You may have done, but her PhD was looking into, was the evidence there at the time when they brought in the low fat guidelines in the 70s? Was the evidence there to do that? And her conclusion is absolutely not. And everything flowed from that, didn't it? Recommending low fat meant that, we had to sort of manufacture products that were low fat because, low fat dairy in its natural form is not low fat. So we had to manufacture some yogurts, and because they had to taste of something, and they had to have a certain consistency, then we added sugar to make them, taste good, and we added various kind of emulsifiers to make them feel right in the mouth. And that, amongst other things, was the beginning of the end, really. But I think I think it's turning around now. I think there's a bit of a backlash. Look at Kennedy being appointed as the health secretary in the States, and he's definitely kind of on the other side of this argument. So, and it's interesting. There was some data came out the other day to show that in the UK, margarine and sales of those kinds of products are going down, and sales of butter and eggs and whole fat milk, whole fat dairy products is going back up again. So I think in the young people, hopefully the message is getting out. We've obviously got Chris Van Tullochen over here. He's a fantastic advocate. He wrote that amazing book, Ultra Processed People. He doesn't want to be, but he's the poster boy really for the real food, argument, the real food movement over here. So yeah, I think unfortunately myself and all of you, we had to learn that actually everything we thought was true was not true to get healthy. I eat lots of salt. I eat lots of fatty meat. I've had a cardiac scan, clean as a whistle, even though my cholesterol's reasonably high. So I don't worry about, high cholesterol is actually protective for older women. There's lots of data on that as well. So I think there's lots of things we have to look at the evidence for ourselves and try and think in a different way. Although it's a bit mind blowing.
Yeah, it is mind-blowing. And the insights that you've given, Jen, they are truly priceless for all of us at D-Life. And everybody who's listening to it, I think people will identify with the fact, and they can go through the craved, tool to identify their cravings and addiction. With that note, I'll call Shashikant Iyengar and Anup also on the screen to say thanks to Jen.
Jen, thank you very much. Thank you for accepting the invite. And I think you're coming in for the second time, of course, in Metabolic Health Conference for the first time, but you had come earlier in the D-Life podcast, and your insights are very valuable, especially on the processed food addiction front, and that's where your strength lies. So we look for more such collaborations in coming times, and we maybe we will meet again once again. Thank you.
I hope so. Thank you so much.
Thank you, Jen.
Please get in